Droopy eyelid from poor vision in one eye. My eyelid really makes me extremely self-conscious. When I was younger, the vision in my left eye was not good, while the right one was perfect. I could see perfectly with both eyes open, but if I was looking out of only the left eye, I couldn't see as well. Fast forward 10 years, my left eyelid is droopy and my left brow is more elevated than my right because I have been straining my left eye without noticing. I'm not terribly worried about my eyebrow, but my eyelid really makes me extremely self-conscious. What can I do to correct it?
Thank you for your question. You submitted your question without a photo, and you're describing in the details of your question that you're concerned about your left upper eyelid position and the arching of the brow. And you described that you were aware that you did not have good vision out of your left eye, and that you had good vision out of your right eye, and 10 years later, the eyelid appears to be drooping further and the eyebrow appears to be arching more. And so it appears that you're concerned about the way things look. Well, I can certainly share with you my thoughts based on your description, of course, in the absence of more details or physical examination. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping patients with eyelids is a very significant part of my practice, particularly for both cosmetic and reconstructive purposes. And so I would say that in your description, what comes to mind is a condition called ptosis. Now, ptosis means drooping, and when it comes to eyelids, we mean eyelid ptosis. Now, in this situation, as you are describing, where you had poor vision out of one eye and the eye was drooping, it is possible that you had a significant what's called congenital ptosis, which means you're born with the drooping eyelid, and that the level of that ptosis may have prevented proper visual development in the left eye, which results in a condition of permanent visual loss called amblyopia. That being said, as it seems that in spite of the diminished vision in that eye, there appears to be an unconscious drive to keep that eye open. That is commonly seen, and it is part of the basis of why that left eyebrow is arched so much. Essentially, there's this unconscious reflex to try to keep that eye open. It's very, very common, and it's common both in patients who have congenital ptosis as well as patients or people who get, as they get older and the eyelids can potentially droop more, who have acquired ptosis or involutional ptosis that comes with aging changes. So I think that it is based on that I think it's important for you to seek a consultation with an oculoplastic surgeon. Oculoplastic surgery, this is what we do. We deal with commonly eyelid ptosis. And it's an understanding of the way the muscles that lift the eyelid work. So for example, if somebody has mild or moderate ptosis and they have good muscle function, you can shorten the muscle and you can get the eyelid to open and look more symmetric. Or if someone has severe ptosis with poor muscle or no muscle function, then you do something called a frontalis sling operation, where you're using the same muscle that you're using to raise the brow to actually raise the eyelid. There is a particular sequence of examination information that's necessary to determine what kind of surgical procedure would be optimal for you. And that's why a consultation with an oculoplastic surgeon makes sense. So look for an oculoplastic surgeon and meet with this doctor and learn about what your situation is. I think it also makes sense to have a proper eye exam with an ophthalmologist and just understand what's going on with that eye versus what's going on with the normal eye, the better seeing eye. And of course, the more information, the better it is for the oculoplastic surgeon to have a strategy to help you and your situation. So I hope that was helpful. I wish you the best of luck. Thank you for your question.